Hello, this is Dr. Grant Cooper from Princeton Spine and Joint Center. In this video, I'd like to address the question of what is gamer's thumb or texting thumb and what you can do about it. Now, before we do that, I've been told I need to pause for a moment to ask you to remember to please like this video, presumably after you've watched it, and please subscribe to our channel to help us continue to grow. Okay, on with talking about gamer's thumb. Gamer's thumb, or texting thumb, is a nickname that's given to a condition called de Quervain's tenosynovitis. And this is the name that's given to an overuse syndrome that results in the inflammation of two of the thumb's tendons, the extensor pollicis brevis and the abductor pollicis longus tendon. So whatever you want to call it, this can happen in anyone who's spending a lot of time texting, typing, gardening, lifting a newborn baby, working with a wrench, or console gaming that involves thumbstick movements. Now, how do you know if you have gamer's thumb or de Quervain's tenosynovitis? Well, it's actually usually a pretty easy diagnosis to make. First, of course, there's going to be pain on the thumb side of your forearm and also your wrist. And you may feel weak in your grip because of the pain. Using your thumb, such as with gaming, increases the pain. You may notice some swelling over the area in question, and you may notice some mild redness and heat from the inflammation of the tendons. Other than tenderness, and it's usually very tender, the best test is something called Finkelstein's test. This is a physical exam maneuver that you can actually do on yourself. What you do is you take your thumb and you grab it with your other fingers so that your thumb is resting in your palm of your hand. Then you gently bend your wrist to the pinky side of your hand. If that reproduces your typical pain, then the test is positive for inflammation of those tendons. If it's negative, you probably have a different problem. Because gamer's thumb or de Quervain's tenosynovitis is an overuse syndrome, one of the first things you have to do is to address the overuse issue. Ideally, you can stop the activity for a while until you're better. If you can't stop the activity because, say, you're a professional gamer and your livelihood depends upon your playing, or because you're a new mother and you're lifting your newborn, or you're a professional handyman, then the next best thing is to try to modify the activity and use a thumb spica splint while you're using your hand. A thumb spica is a small splint that stabilizes the thumb, which helps to relieve the stress from the tendons. However, because it immobilizes the thumb, it's also difficult to wear during activities that require your thumb. Getting the thumb better is ultimately going to be about getting the inflammation to go away. Because the problem is inflammation in the tendon sheath, which is close to the surface of the skin, topical anti-inflammatories can be very helpful for this particular condition. Specifically, using ice and also using topical diclofenac, which is a topical NSAID like topical Advil, can be very effective. Voltaren gel is an excellent over-the-counter topical diclofenac, as an example. The advantage of topical diclofenac instead of an oral NSAID, again like an oral Advil or an oral Aleve, is that with the topical, the medication will diffuse directly to the site of inflammation. This is true with ice too. The cold from the ice can diffuse directly to the site of inflammation. When it comes to topical diclofenac, you can put it on 4 times a day as you try and also rest the thumb, and ideally use the thumb spica splint as much as you can. Another good approach is physical or occupational therapy. In therapy, the therapist will show you exercises and tendon glides that you can do for your hand, and the therapist can also apply passive anti-inflammatory modalities such as ultrasound and soft tissue mobilization to help calm the tendon down. Now, if symptoms persist despite all of this, a steroid injection can be performed. An important point about steroid injections for tendinitis. 1, they should always be done under ultrasound guidance. This ensures a few things. It ensures that the medication will not be injected directly into the tendon itself, but rather into the tendon sheath. This is important for safety, and it also ensures that the medication makes it to the site of maximal inflammation, and this allows it to be as effective as possible. The second important point with steroid injections for tendinitis is that the tendon should be rested for a couple of weeks after the injection to allow for the medication to work, and also so that you don't accidentally injure the tendon before it's ready to be used. And as you get back into your activity, you're going to want to progress gradually with the guidance of your doctor. Another medication that can be injected is Toradol. Toradol is a non-steroidal anti-inflammatory medication that's sort of like liquid Advil. The advantage of using Toradol is that it isn't bad for the tendon and it can still work really well. The disadvantage is that it's not as strong of an anti-inflammatory as steroids. Still, if you're concerned about the overall health of the tendon, then Toradol may be an option to try before or instead of a steroid injection. If the Toradol injection doesn't work, you can always try the steroid injection later if you need to. Now, there are also regenerative medicine techniques such as platelet-rich plasma, or PRP, or prolotherapy, and others. The purpose of regenerative medicine techniques is basically to stimulate the body to unlock its own innate healing properties to scar down on itself and basically to fix itself. In PRP, for example, blood is aspirated from the patient, the platelets are then spun down in a special centrifuge, and then the platelets and their growth factors are injected back into the site of inflammation, where ideally they stimulate the healing response in the patient. The main drawback of regenerative medicine techniques is cost. Depending on the regenerative medicine technique and depending on the doctor that's doing it, the area they're in, costs can range from anywhere from $750 to $3,000 or more dollars. So this is a real consideration. If costs weren't a factor, and if this were an insurance-covered procedure, I would probably recommend it for patients before and hopefully instead of steroid injections for Gamer's thumb or decurving tenosynovitis. But the cost is real, and so this also needs to be discussed with your doctor. Now, finally, there are surgical options for de Quervain's tenosynovitis or Gamer's thumb. I've seen hundreds of patients with de Quervain's, and so far all of them have gotten better without needing surgery. That said, surgical release of the tendon sheath relieves the pressure and the friction of the tendon, allowing ideally for pain-free movement. And this can also often be done under local anesthesia while the patient is awake. So sometimes it is going to be the best option if the symptoms aren't getting better with more conservative care. So if this is the case, then the surgical option is definitely something to discuss with your doctor. And lastly, when returning to life as your thumb is improved, there are some general principles that you're going to want to follow. First, you want to go back to full activities gradually as opposed to all at once. When it comes to the activity that brought it on in the first place, assuming you can identify that activity, such as, for example, with Gamer's thumb, you want to make sure that your ergonomics are set up as well as possible. You're going to want to make sure that your wrist is in a neutral position when you're using your wrist and hand repeatedly. Also, take a few minutes to warm up and get the blood flowing into your hands and loosen the muscles up before you start playing or before you start working. And finally, take breaks to avoid overuse from whatever you're doing. Even a 30-second break can make a difference. So try and stop every 20 to 30 minutes and just, shake your hands out and rest for 30 seconds. Do this before you start getting any pain. If you think you might have overdone it on any given day with an activity, try icing it afterwards. Okay, that's it. Thank you very much for listening. I hope you've enjoyed this video. If you have enjoyed it, please remember to like the video, subscribe to our channel to help us continue to grow. And if you have any questions or comments for me, you could reach me at drcooper@princetonsjc.com, or feel free to leave a question or comment in the comment section here. Thank you very much.